Good day. Today, I would like to spend some time chatting about Chapter 11, which is the topic of health, disability, and long-term care insurance. As I've mentioned to you many, many times, I am not a huge insurance fan, and there are really only a couple of types of insurance that I would ever speak with you about in terms of it benefiting your life as opposed to simply costing you money every year in the form of an annual premium that eventually just goes to line the pocket of the insurance salesperson that sold you the policy. However, health, disability, and long-term care insurance are definitely three types of insurance that we need to have a conversation about. So in this chapter, we've got 6 different learning objectives, right, that are going to kind of span the topics revolving around these 3 different types of insurance. Okay. First, we'll talk a little bit about what are the costs that come along with A, providing, and B, owning health insurance, and why the cost of health care has been increasing exponentially over the last 15, 20, 25 years, and why it's not expected to slow in my lifetime and not in your lifetime. We'll talk a little bit about what the definitions are around health insurance and disability insurance, and why these 2 types of insurance are important from a planning standpoint. All right, which is kind of something we've been talking about all semester long. We'll look at some of the benefits and limitations of the types of healthcare coverage policies that exist. Okay, we'll talk about co-insurance. We'll talk about PPOs, HMOs, private healthcare. We'll briefly have a conversation around the Affordable Care Act, right, which is the government-provided healthcare program. And then lastly, a few little nuggets to recognize when you need disability income insurance versus when it's just kind of a nice to have. Keep in mind that when you get your first job outside of academia, that your company will be offering you a health insurance package. They will be offering you the option to purchase additional disability income insurance. And most of them nowadays are even offering you the ability to purchase supplemental long-term healthcare policies. Okay, so what we're going to talk about here in this segment is going to be very applicable to what you're going to see when you get that offer package from the company that you're going to be looking to work for. Okay, so healthcare costs. Right. So what are some of the costs that are associated with health insurance? Okay, and we live in a very real, with a very real fact that health care costs are rising exponentially over time. And we know that the United States has the highest per capita medical expenditures, okay, of any country in the world, right? I believe in 2019 that the average per capita cost of healthcare in the United States was just shy of around $12,000 per person, okay? That is astronomical compared to the other countries around the globe. So if we put that into context, it is literally about twice as much that's spent on healthcare, okay, as the average for the 24 industrialized countries in Europe and North America. Okay, so we spend a tremendous amount of money on healthcare in the United States. Okay, now we could have a debate, okay, for days probably, as to whether or not we as a country, we as a federal government, we as a state government need to do more for our citizens in order to provide a lower healthcare cost through the concepts of, let's just call it socialized medicine, government-run healthcare programs. So that's one argument. The other argument, the other side of that equation, is that having a free market healthcare system, somewhat like we have today, all right, should create competition. And therefore, by creating competition, even though we're spending twice as much as developed Europe, we should be getting access to higher quality healthcare via that competition. Okay? So there's definitely arguments to be had on both sides of this coin as it relates to the cost of healthcare in the United States. So in general, if we compare the overall cost of healthcare, all right, to the GDP of the United States, okay, the GDP in 2019, okay, was, you know, roughly $20 trillion, something like that. All right. So if we look at the healthcare costs at 3.9 trillion, okay, that represents almost 20% of the U.S. gross domestic product. So in case you forgot from your economics class, the gross domestic product is the total value of all of the goods and services produced within a given economy. Okay, so in the case of the United States, with the GDP of approximately $20 trillion, that means in 2019 that the estimated total value of all of the goods and services produced here in the United States, right, was roughly $20 trillion. And of that, healthcare expenses represented approximately 20% of that number. Astronomical. And by 2026, we're forecasting that number to grow to $5.7 trillion. Okay, so nearly double what it currently is right now. And with that said, you know, we've got about 32, 33, probably a little bit more now as a result of the virus. Around 32, 35 million people that don't have health insurance coverage. Now, we could also debate whether or not this is acceptable or not. Okay, there are some that believe that health insurance is a personal choice, that some people of this 32 million, okay, have simply elected to not carry health insurance, whether it's because they don't believe in it, or whether it's because they feel it's too expensive, or whether or not they simply can't get access to it. There are probably a portion of these 30 plus million people who have by choice elected not to have health insurance. On the other side of the conversation, we have many progressives who believe that health insurance is a right and that everyone should have government provided health care, very similar to like a Medicare for all package. Okay, but nonetheless, right now there's about 30 to 35 million folks in America that don't currently have health insurance. Okay, so when we think about some of the costs that are associated with having a health insurance program or sponsoring / administering a health insurance program, it's fairly expensive in the United States. Okay, about 11% of each healthcare dollar, okay, each dollar of healthcare, okay, goes into simply taking care of the administrative costs surrounding the implementation and ongoing administration of the healthcare program that exists. And that's versus 1% in Canada. Okay. Now, I don't know enough about the Canadian medical system or healthcare system to give you any real insight into why there's such a dramatic difference in the administrative costs between the United States and Canada. But nonetheless, the point here is that having a healthcare program in the United States is expensive. So why does it cost so much? All right. Well, because of the competition that we have for healthcare in the United States, right, it has created very sophisticated and very expensive technologies. Okay, we've got duplication of tests and technologies. Okay, we're sometimes required to get 2 or 3 different tests for the same affliction that we might be going to see our doctor for. Okay, just to simply prove to the insurance company, right, that what the doctors say we have is what we have, before the insurance companies will pay any money to take care of the affliction. So duplicity of tests and technologies sometimes costs a lot of money. Okay. We have an enormous increase in the variety and the frequency of treatments. It seems like every other week they're coming up with some new test to see whether or not we are as healthy as a population as we thought we were 6 or 7 months ago. And quite frankly, here in the United States, we tend to live longer than other countries around the world. Okay, so as we live longer, the cost of our healthcare continues to grow for a longer period of time. Okay, so as we have our parents and grandparents, okay, living into the later years, which is great, we want them around as long as possible. Okay, but it does place a burden on the overall system, okay, which then we, as the younger generations, wind up having to pay for through the form of higher taxes, higher healthcare costs for ourselves, higher insurance premiums, okay? So the increasingly long period of time that we are living now also contributes to the cost of the healthcare system. And then a big one that we like to talk about and don't like to talk about is regulation, right? Things that the regulatory agencies implement that result in just shifting the cost, moving it from one bucket to another, okay, rather than spending time actually driving cost out of the system. Okay, simply moving an expense from one general ledger account to another general ledger account, making the original GL look better, okay, isn't reducing cost. We're just changing buckets. Okay, and then we have, as the population has increased, and as a result of the population increasing, even if we kept the same percentage of crimes that occur and accidents that occur, the more cars we have on the road, because we're growing as a society, the more packed our big cities get, the increased probability that accidents and crimes are going to occur. That's just basic statistics. Okay, so the need for emergency medical services has also grown exponentially. Right? So there's a lot of reasons why healthcare costs have skyrocketed over the last 15, 20, 25 years. Now, is the United States unique in any of these 6 bullets when compared to other countries? I would say not unique in any of these bullets as it would compare to the developed countries around the world, right? So we still have not explained why the United States in particular, okay, has the highest medical expense of any developed country in the world, right? All of these bullets are factors into why that's the case, but none of these 6 bullets by themselves can explain why the United States has the highest cost of healthcare. So if we think a little bit more about the healthcare system in the United States, You know, I mentioned that we've created a competitive environment for healthcare, and that is true. Like, we do have competition in the sense that we have multiple companies that compete to offer and provide insurance programs, healthcare programs for the general public. Okay. However, right, it's limited competition. Okay. And the restrictions that are placed upon the work of these healthcare companies, okay, in terms of the delivery of their healthcare and how they go about doing it, even though we have competition from the standpoint that there's not just one single player in the healthcare game, right? There are huge barriers to entry to prevent any additional competitors from entering the market. Okay. So when you think about Cigna or Blue Cross Blue Shield, right? They, even though they are competitors with one another, okay, they're not facing external threats to drastically force them to change their business model. Okay, so even though they're competitors, there's not any real external threats, okay, to their business model. Right? Initially, when the Affordable Care Act was implemented, many of these large healthcare organizations that are publicly traded companies took a big hit, took a huge hit, because the thought was that with government-sponsored healthcare programs, okay, many of the people who were currently on privately provided healthcare programs would leave and go to the government-sponsored programs. So many of their stock prices took a huge hit. Well, that clearly did not pan out the way that President Obama expected, okay, because it is extremely expensive to purchase healthcare insurance from the ACA, right? And, you know, the private companies like United Healthcare, Cigna, Blue Cross Blue Shield, you know, their stock prices have recovered since then. Right? We also have this aspect of, you know, labor intensiveness, right? The healthcare system is very labor intensive, not only from a just back office administration standpoint, right? But just from providing the actual care, the end provider of care. Okay, it's very labor intensive. Okay, and what that has a tendency to do, right, is when you have quality labor, doctors, nurses, triage staff, okay, what's the nurse practitioners, okay, and they're good, all right, because we have a competitive environment, right? Their earnings can increase drastically in a very short period of time, okay, because they're going to get paid to get hired away from where they are to their new place of employment, okay, because of their quality, right? So competition, okay, has created those sophisticated work environments, and it allows for a place for talented workers to grow, and as a result of their work and their talents, that allows them to grow their wealth, right? So in a government-run healthcare system, that is not something that would exist, because there would essentially be no competition. Okay, you get paid what the government says you're going to get paid. No different than if you work in the FBI, you work for the Secret Service, you're on pay scales. Okay, so healthcare costs are higher in the US because we do have that competitive marketplace that we operate within. Sometimes this is definitely the case. You know, sometimes we, as a society in the US, have a tendency to use more expensive medical care than might be otherwise necessary. Okay. Why? And it's kind of a silly answer, but because we can, okay? Because it's there, okay? Because using more expensive care makes us feel like we're being taken care of better, okay? And if we can use it, then why not use it, right? So in many ways, this use of more expensive care than what otherwise might be necessary, okay, is no different than the type of car we might buy, right? Could we spend the rest of our lives driving a Honda Civic to and from the office every day? Of course. And there's nothing wrong with a Honda Civic. I love Honda Civics. Matter of fact, I had a Honda Civic for many, 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 many years. And when my kids get old enough to drive, I'll probably get them a Honda Civic. It is a great car. It will last forever. Gets great gas mileage, good for the environment. Okay. Decent technology within the vehicle. Gets you from point A to point B, no problems. Okay. But there's also something really nice about driving a BMW M3 to get to that same job, the same number of miles every day. Okay. But why would we choose the M3? Because we can. Okay. So it's no different than in the healthcare world. And we also have, a highly litigious society here in the United States. All right. So malpractice insurance and fraud are also contributing to the cost of healthcare within the United States. Okay. We have the largest population of folks in America who are starting to enter into progressive care and retirement communities, okay, the baby boomers, right, which is going to also stress the healthcare system because most of them will be on Medicare, right? It is going to stress the medical system more than it's been stressed probably ever over the course of the next 10 to 15 years. And with that population obviously not working, okay, the cost of that falls on me, falls on you. Okay, so that increases the cost of the healthcare programs drastically. So now that we've talked about some of the costs, like what are we doing or what can be done, okay, to at least manage these high costs, right? So what we have to be very careful of is the fees and the charges that exist within this healthcare pipeline system, okay? And eliminating charges from each step of the way, okay? So think about it in terms of like a value-added tax, right? A VAT charge, where at each point of the supply chain during the production of a product, each section of the supply chain is taxed, okay? Figuring out a way to review where in the healthcare supply chain the taxes are coming and eliminating as much of that fat as possible. We also need to incorporate what's called preventive maintenance. Okay, when I was working for BP in Houston, this was a big thing. You didn't just wait until the pump stopped working. Okay, you periodically took the pump out of service, okay, cleaned the impellers, put new lube in the gearbox, okay, changed out some flanges, some gaskets, and put the pump back into service to keep it running. No different than in our personal lives as it relates to healthcare. Now, I will admit to you, I have not been very good in my own personal preventive care. Okay, over the last 6 months, the pandemic has kind of taken its toll. All right, but nonetheless, okay, we can keep costs in our healthcare system down by establishing incentives for healthcare, the insured, okay, for preventive care and services that get provided outside of the hospital, okay? So offering incentives for insured individuals to get to the gym, to get your annual physical, okay? Things that are preventative in nature, okay? So more proactive, right? Instead of reactive, meaning when the incident, accident, occurs, then we do something about it. Okay, getting your community involved. Okay, the balancing of those healthcare needs and the healthcare resources. Okay, the more that everybody's taking care of themselves within a community, the less of a burden that it places on the healthcare system and resources in those communities. Okay. Prepaid group practices. Okay, we'll talk a little bit about that here in a second. All right. Education programs. Right? We don't know what we don't know, and so educating the population around ways that they themselves can keep themselves out of the medical system through these preventive care practices helps drive costs out. Okay. And then lastly, paying cash for routine care. Right? This sounds kind of silly, but it's true. Right? If we put our copay, on our credit card, right? Which, fine, whatever. The medical provider, right? They have to pay a service fee for that charge. Okay. Whereas if we simply paid cash, that service fee doesn't exist, right? And if they are doing the right thing and their goal truly is to drive down costs, then they at some point should be able to lower the cost of the services that they're providing for those recipients who pay in cash. Makes sense. So when we think about things that we as individuals, okay, can do to reduce our own personal health care costs, right? We have access to what are called FSAs, okay, or flexible spending accounts, right? These are accounts that are offered, that we can take advantage of, that we are able to contribute pre-tax dollars into. Okay, so we're saving tax on our income by contributing pre-tax to these flexible spending accounts. Okay, and we can use these funds for anything that is remotely related to your medical needs. Copays at the doctor's office, okay? Toothpaste at Walgreens, Tylenol at CVS, okay? Pretty much anything associated with caring for your medical or preventive care needs can be covered using this flexible spending account. So you sign up for it. You have money that comes out of your paycheck that goes into this flexible spending account, and you basically get the equivalent of a debit card, okay, that is tied to this FSA, and you get to use it as you see fit, pre-tax dollars contributing towards your medical expenses. Okay. High deductible health plans, right? So you guys are young, all right? You're in good health. The likelihood that, anything is going to happen to you that is going to immediately cause a drastic change in your lifestyle is fairly low, right? So when we have a high deductible, meaning we pay more out of our own pocket before the insurance company starts to pay, right? The more that we can do that, okay, the lower the overall cost is in the system, okay, and the lower overall cost that it is to us, okay. High deductible plans are cheaper than low deductible plans, okay. It makes sense. The longer that the insurance company doesn't have to make a payment, okay, then the cheaper it should be for you to own that policy. Okay. Using generic drugs versus name brand, okay. I don't know, as an engineer, I still am a big believer in using the name brand drugs as opposed to the generics. On the other side of that coin, there's a lot of people who have no problems using generics, so that choice would be entirely up to you. But just know that there is a difference in cost. Generic drugs are going to be less expensive than the name brand drugs, plain and simple. Okay. This is an interesting one. This is a really interesting one because, you know, for forever, right, up until probably five, maybe 10 years ago, maybe 10, but definitely 5. The only place that you could really get your prescriptions filled, right, were either, let's just say they were brick and mortar pharmacy stores, right? You go to the Giant, okay, they have a pharmacy. You go to your local pharmacist right on the corner. There used to be one over off of York Road, kind of in the Annesley area. Okay, but you had to go to a physical location to get the medication that you needed. Well, Amazon is now getting into the the online pharmacy business. Okay, and when that happens, I think we're going to see a drastic change in how pharmacies go about doing business, right? Amazon disrupts pretty much everything they get into, okay? So we'll have to wait to see how all of that pans out, but they have applied, I think it's with the FDA for their license to be able to sell mail order medication, which should drive costs down, right? Amazon can use the existing infrastructure and supply chain that they already have, okay, to enter into the online pharmacy market space. Okay, so that should drive the price down for much of the medications that we as a society consume on a fairly regular basis. In many cases, a number, depending upon your level of income, okay, many states offer state plans, okay, for prescriptions, right? But I don't think that any of you right now are going to need to worry about that. But just know that in the event that you are income limited, that most states do have options for state managed prescription drug plans. Okay. And this is a big one. You know, if you can follow up with your doctor instead of having to go in, okay, if you can follow up with him via phone, do that. All right. It saves money all around, saves you money on gas, saves you money wear and tear on your car, saves him time because he can then spend more time with the patients who actually need the help in his office. Okay. So it just strips a layer of cost out of the whole system if we can make our follow-up phone calls you know, remotely over the phone. Okay. All right, you know, non-urgent procedures. You know, these are the kinds of things that you know, non-life-threatening procedures, elective procedures, as we've heard over the last 7 to 8 months. You know, Johns Hopkins has stopped offering elective procedures because of the coronavirus situation, in order to make sure that they have the maximum number of hospital beds available. Okay. Errors happen, all right, mistakes happen, all right, but that's a cost in the system, right? So just check your bills when you get them and just make sure they're correct, right? And then we can also look at the appeals process with our health plan and our healthcare provider. Okay. If something is denied or something is granted, right? We have the ability to appeal any sort of unfair decisions that our healthcare providers might decide. And then this is kind of just the big one, you know, practice preventive care. All right, just stay healthy. Stay healthy, eat healthy, be healthy. All right, keep stress out of your life. All right, practicing preventive care is probably the single biggest factor towards just simply keeping our overall personal health care costs down. So again, stay well, right? Balanced diet, avoid smoking, don't drink to excess. Yeah, well, we've all heard these things for years, right? Get rest, right? Be careful when you're driving, right? Do the things that we kind of talked about in terms of prevention, all right? When we talked about risk, okay, during the home and rental and auto insurance lecture, right? Do the things that you need to do to help prevent accidents from happening. And that will lead to just a healthier lifestyle in general. Okay, get your annual physical, right? And if you have chronic conditions, make sure you stay on top of them, okay, to manage them as best as possible. Okay? Don't let them get out of control. So when we think about health insurance as it relates to financial planning, okay, we first have to identify and define what health insurance and disability insurance are before we can get into why it's important that these two insurance products are a part of the financial planning that we're going to do in our personal lives. So health insurance, okay, reduces the financial burden that people suffer due to illness and injury. Okay. So we talked about risk. This is a method of risk shifting, right? We're shifting the cost of the risk from ourselves to the health insurance company. And it's part of our overall program, okay, to make sure that we're safeguarding our family's financial stability, okay, security. And when we talk about health insurance, we're talking about the medical expense, okay? We get sick, we go to the doctor, we have a bill, the health insurance company helps cover a portion of that cost based on the premiums and the deductibles that we're paying for. So the health insurance piece comprised of the medical expense insurance as well as disability income insurance, meaning if you get injured, okay, and you are unable to work for a period of time, then this insurance policy kicks in to help cover a portion of those lost wages. So when we think about how some of the insurance products have changed, okay, we're talking about group health insurance, okay, because just like we were speaking about in terms of automobile insurance, you as the health insurance policyholder, you're in a pool of people, okay? You're put into a pool of people, right? The risk that you specifically as an individual pose to the health insurance company, okay, is a lot greater, okay, than the overall risk of a large population of people, because you're talking about one data set, you, versus a much larger data set. Okay, so group plans, all right, where the price of the plan, the price of the healthcare coverage, okay, it is determined based upon the group. About 90% of all the plans that exist are group plans. Okay, and most group plans, okay, are what we call employer sponsored, okay, where your company covers most, if not all, of the cost. Okay, so when you go and you get that nice job outside of academia, okay, and they present you with your benefits package, and a part of that package is the healthcare plan that they offer to you, okay, the cost that you see for the various plans is not the actual overall cost that the company is being charged. Your company generally, okay, generally, and most of the time, 90+% of the time probably, okay, covers 80 to 85% of the actual cost. And the cost that you see in that benefits package only represents what's left. Okay. So you pay for a portion of the overall cost to the company, but not the whole bill. Okay? And some companies will actually pay your entire health insurance, which is great. Okay? I believe CFG Capital Funding Group over in like the Mount Washington area, I believe that they offer like full healthcare coverage for all of their employees, which is freaking fantastic. Okay. The TCJA back in 2017, that was kind of the one of the things that Trump put in place, required that large employers, meaning anybody that employs over 50 folks, that they had to provide healthcare insurance coverage to all their employees. Right. So again, we talked about cost. Right. Clearly, this bullet adds cost, okay, because the company wasn't paying for it before, okay, and odds are if the company wasn't paying for health insurance of the people who were working for this company, right, the vast majority of them probably elected not to have health insurance coverage because the expense of the ACA coverage is astronomically expensive. Okay, so yes, it added cost to the business, okay, but it also gave access to more affordable, higher quality healthcare coverage for the employees of these companies. So we can have a debate on, one side of that coin or the other, but nonetheless, that is what happened back in 2017. So another part of this group health insurance concept is that back in 1996, Congress passed what's known as Hipaa, okay, which allows for the portability, okay, of health insurance, right, and new standards surrounding it. Okay, so non-discrimination in health insurance and guaranteed renewability, meaning that if you work for, I don't even know, if you worked for Brown Advisory, right, and you were on their health insurance program, and you suffered a major health event, right, as long as you remained employed, right, by Brown, right, then you were guaranteed to have your health insurance coverage renewed every year during the renewal time. Okay, they could not discriminate against you simply because of the health event that you had. Okay, so HIPAA is pretty important towards us being able to ensure long-term healthcare coverage. Okay, so when we think about, we had group plans, right? And then we have individual health insurance and how we go about supplementing the group insurance that we might have. Okay, so you might have a chronic condition, okay, that goes above and beyond, or the needs that you have go above and beyond, okay, go above and beyond the coverage that your group policy offers. Okay. And when that's the case, you have access to individual health insurance, okay, which allows you to tailor your health insurance policy to your specific needs. And you can go and you can get this supplemental policy from a whole host of companies, okay, at your choice. So what does this do? It supplements the group insurance, okay? So we have what's called, okay, the coordination of benefits provision, which basically says that the benefits that are received, okay, from all of the available sources to receive payment, okay, are limited to 100% of the allowable medical expenses. Now, I know you're probably thinking, well, duh, yeah, that makes sense. Like, why would insurance companies pay more than the 100% of the bill? Well, it happens, okay? And so this coordination of benefits provision, okay, allows for your health insurance needs to be taken care of by multiple policies, okay? But the benefits that are received from all of these sources, okay, is limited to 100% of those allowable medical expenses. Okay, so coordination of benefits seems like it should be intuitive, but for a long time it wasn't. And the system was collecting way more than 100% of the allowable medical expenses. So we're not going to talk too much about this because I don't think any of you are really in a situation where you're going to need to worry about divorce in the next couple of years. Okay, and please God, I hope you never have to deal with it because trust me, no fun, no fun. Okay, right. And then finally, if you leave a company to move to a different company, there's a period of time that you will remain covered under your former plan, but then they have a plan that is offered, which they call Cobra, and that is simply where it requires many employers the ability to extend or continue the group coverage, okay, for a period of time. Okay, here it says following a divorce. Yes, that's true, but also following after departure from the company you might be working for. Okay, in order to at least offer you the ability to continue receiving coverage from that plan. Now, Cobra is expensive. You bear the full brunt of the cost. The company no longer supplements your healthcare coverage at that point, but they at least are extending you the opportunity, okay, to remain covered. Okay, so when we think about your life after academia, right? What should you be looking for in a healthcare plan? Right? Well, a good, decent healthcare plan is going to offer a number of different things. Okay? It's going to provide you with basic coverage for hospital and doctor bills. Okay, you're going to have a copay, and that's it. All right, you're not going to get hit with a litany of expenses. You got your copay. Go see your doctor, you pay 20 bucks. Okay, go get your eyes checked, you pay $10. Whatever the plan is, it needs to have some basic coverage. Okay, you want to make sure that at a minimum, okay, it includes 120 days of hospital room and board. It provides at least $1 million, okay, for lifetime maximum for every family member. Right? These are just some of the things to keep in mind when you're evaluating the robustness of the plan that your future employer is offering. Okay? 80% minimum copay of out-of-hospital expenses. Okay, and that's after your deductibles, obviously. Okay? And the deductibles can range anywhere from $1,000 a person. I've seen $500 a person, which is very expensive in terms of cost to you. But you're going to have a deductible that is specific to you as the individual, but also as the family as a whole. So if you have multiple people on the policy, then as long as you hit one or the other, okay, then your deductible has been covered. Okay. The fifth bullet here, that there's no imposition of unreasonable exclusions. Okay, so yeah, you've heard about pre-existing conditions, right? So you want to make sure that the insurance policy that you have, okay, allows for pre-existing conditions. Most all of them do, but you just want to make sure that it does exist. And then you also want there to be kind of a maximum out-of-pocket expense, meaning that there's a cap at which you have to spend money, okay? And anything above and beyond the MOP, the maximum out-of-pocket, the insurance company will pick up. Okay, so typically the MOP is somewhere between $4,000 and $6,000, depending upon the type of policy that you select. Okay, so in terms of cost, the lower your deductible, the higher your premium is going to be. The lower your MOP, the higher your premium is going to be. So in combination, if you have a low deductible and a low MOP, then you're going to pay a considerable amount of money for your insurance policy. Okay, and there could come a point in time in your life, in your life cycle, where you need to do that, right? But right now, at your age, odds are that you don't necessarily need to spend that extra money to have such a robust health insurance plan, unless you know that you're going to need it. Okay. So types of medical coverage, we've got hospital expenses, right? So these are things like the hospital room and board and other fees that are assessed by the hospital. You have surgical expenses, okay? So that's the fee that you pay to the surgeon, okay? Or the anesthesiologist, right? Specific to them, that's outside of the expense that the hospitals incur. And then you've got just general physician expense insurance. So as you can see, you've got all these different layers of expense that go into, okay, the overall cost of medical coverage. Okay, so your physician expense pays for your office visits, okay, your lab tests, x-rays, but it's not surgery, okay? This is just kind of like your general ongoing maintenance, right? But it's not surgery. Okay. We've got other things that are involved with the medical coverage, things like major medical expense insurance, okay? So this is in addition to your basic plan. This will help cover expenses that are incurred as a result of serious injury, okay, or some sort of long-term illness. Okay, so it's supplemental to your basic plan. And it also has a deductible, just like your basic plan does. Okay. It has co-insurance, like we've talked about. Okay, so something like an 80-20, meaning that you pay 20% of the amount above your deductible, and the insurance company would pay 80% of the amount above your deductible. That's an 80-20 co-insurance. And a stop loss provision. Okay, so the MOP, right? Maximum out of pocket. We've got something that's also called comprehensive major medical insurance, right? So it's something that you can purchase, okay, on your own without having to have a basic plan. Okay, so the major medical, okay, adds to the basic plan, supplements the basic plan. Comprehensive major medical is a totally separate plan that has a low deductible, okay, that's offered without the basic plan attached to it. And it can be used to cover things, expenses at the hospital, surgical, medical, other bills. Okay, so it's simply another type of insurance that helps supplement, okay, plans that you might already have. So as you can see, the insurance world, there's a product for everything, okay, which again kind of gets to why it's so expensive to have healthcare in the United States. Okay? Because it takes time and money to develop these products, right? And because not every person in America, okay, is going to be using every single one of these products, right? It is expensive to create these new products, right? And not everybody's going to use them. So it creates cost that doesn't necessarily need to be there, okay? So hospital indemnity policies, right, where they pay cash for benefits when you're hospitalized, okay? Okay, so meaning that you get some sort of cash benefit payment when you go into the hospital to help cover, offset some of the expenses that you're going to be incurring. We've got dental insurance. Obviously, you know about this. Exams, cleanings, x-rays, fillings. You know, we have insurance to help cover the cost for taking care of the things inside of our mouth. We've got vision care insurance. Okay, contact lenses, glasses, annual eye checkup. And I need to actually schedule an appointment to have my eyes checked because, as you guys have spent so much time in front of the computer over this last semester, I have also done the same, and I can definitely tell a difference in my vision. All right, and so again, there are so many different types of insurance policies that are out there. You've got things like dread disease policies, okay, almost like, you know, act of God type policies, trip accident, cancer policies. This one, the focus on unrealistic fears, okay, that's what these other types of policies tend to cover. All right, you have a fear of being caught in a tsunami. All right, they have a policy that you can buy that would cover your fear of being caught in a tsunami. Okay, so these other types of insurance policies are really nothing more than a way for insurance companies to make money, for the salesperson to make money on your fears, and they are of extremely poor value. So when we get into what's next here about deductibles and co-insurance, okay, we're going to get into an example of how all this kind of comes together, okay? And we're going to look at this lady, Ariana, and her policy is going to have an $800 deductible, and she's got an 80/20 co-insurance, okay? So she just received this hospital bill, $3,800. Okay. Well, she's on the hook for the deductible. So the first $800 of this $3,800 bill, she's paying for, right? Because that's her deductible. Co-insurance doesn't kick in until she exceeds the deductible, okay? So the insurance company excludes the first $800 from the coverage, okay? Because Ariana is going to pay for that. Then above that, so the $3,000 that is left, okay, the insurance company will cover 80% of that $3,000. So the insurance company will pay $2,400 of this bill. Okay? So the insurance company pays $2,400. Okay? And of the $3,800 total bill, that leaves $1,400 left for Ariana to pay, $800 of which is the deductible, and $600 of which is the remaining co-insurance from the $3,000, okay, post-deductible. Okay, so insurance company pays $2,400 of the total bill, and Ariana pays $1,400 of the total bill. All right, still not a bad deal, right? The insurance company is paying, you know, almost twice what Ariana is paying for the insurance, so she is getting a benefit. But this is a good illustration for how the deductible and co-insurance provisions work within these healthcare policies. Okay. Long-term care insurance. This is an important policy for you guys to start thinking about, especially at your age, because this will be the single largest expense that you have in retirement. Okay. And the policies that you can purchase today, right, are the cheapest that they're ever going to be for you because of your young age right now. So these policies really didn't exist, okay, in the early part of my lifetime, okay? But it is the fastest growing form of insurance in the marketplace. Okay. There have been a number of studies that have been done. Okay, and roughly 20%, roughly 20% of the population of individuals over the age of 50, okay, is going to be at risk of needing some form of long-term care within the next 12 months. Okay? And more than half of that population, okay, is going to need long-term care at some point. And long-term care is expensive. I mean, it is not cheap. Okay. And when we're talking long-term care, we're talking about, having to need assistance in the home. Okay, we're not talking about moving to an independent living facility. We're talking about you not being able to perform most of what we call the ADLs, the activities of daily living. Okay, and it can be extremely expensive. And on average, this is on average, and I got to go back and look at this number because I think this is even too low. $97,000 would buy you 1 year in a low rent nursing home. Okay, so if you do need care, all right, and you do not have a long-term care policy, okay, you're going to have to find other ways of covering $97,000 of expense just for a nursing home. Okay, so again, you are at little to no risk of needing nursing home care at this point in your life. Okay, but at some point, many, many, many years down the road, okay, you might. Okay, so purchasing a policy today at an extremely low rate, okay, to help cover those expenses later on can be of great benefit to you. Okay? And depending upon the type of policy that you're looking at getting, those annual premiums for the policy can run anywhere from $2,000 to $16,000. Again, because of your age, you're going to be potentially even less than $2,000 a year for these types of policies. So when we think about some of the provisions within, health insurance policies, one, eligibility, right? And eligibility is an interesting one because it does vary by age, okay? It varies by marital status, and it varies depending upon how many dependents you have, okay? So there are eligibility requirements for certain policies. We have things that are called assigned benefits, right? This is the insurance that gets paid directly to your doctor or hospitals, okay? Where you don't have to cut your doctor or hospital a check, right? The insurance company pays them directly. We have things that are called internal limits, right? Meaning that hospitals are not allowed to charge more than a certain amount for each hospital room per day. We have the co-payments. Again, we just talked about that. It's in its most basic form, it's what we call cost sharing. Okay, so cost sharing in the form of a flat dollar amount that you pay. You go see your doctor, you have a copay of $20. You go see your doctor, the copay is $30. Okay, that's determined by the plan that you have in place. We have service benefits. Okay, these are benefits, or we call them entitlements, to specific care, okay, rather than a fixed dollar amount per procedure. Okay? And then lastly, we have what are called benefit limits, meaning that's the maximum dollar amount, okay, that can get paid per hospital stay, or it's the maximum number of days that the insurance company will pay for hospital visitation or hospital stays. So there's a limit to the benefit that the plan, the policy will provide. Okay. We have exclusions and limitations. They're there. Okay, you just got to read and make sure that the exclusions and limitations of the plan you're evaluating will not negatively impact your ability to obtain care. We talked about the coordination of benefits provision, meaning we have multiple policies and the benefits from those policies are coordinated such that it can't exceed 100% of the total expense. Guaranteed renewable, right? Can be canceled and terminated, what the provisions are around how your insurance plan could be canceled or terminated. It's got to explain the circumstances, so you need to read the provisions of the policy. So obviously there are trade-offs, right? Health insurance trade-offs. This reimbursement concept versus the indemnity concept, right? Internal limits versus aggregate limits, deductibles and co-insurance. Pardon me. Out-of-pocket limits, okay? Benefits that are based upon reasonable and customary charges. Right? So there are definite trade-offs, but you can now see from this conversation why the healthcare costs in the United States are as high. I don't want to use the word excessive, but they are higher than the rest of the world. Okay. So the question is, right? Which do you choose? Okay. Which do you choose? And you've got three choices basically. You've got the healthcare, the basic healthcare plan. Right? You've got the major medical that we talked about. And then you could elect to have both if you wanted the maximum amount of coverage possible. And we also have private sources of health insurance. Okay, so these, okay, you're going to see these in the benefits package, right, from your companies. Okay. So we're going to have a conversation here around HMOs and PPOs here in just a second. So you need to evaluate the different offerings that these companies have. Okay. You can get an individual policy, you're going to pay more for it. Okay. But you can also have a group policy that's provided to you by your employer, okay, that a policy is sold to them by these private insurance companies. And we think about the hospital medical service plans, we're talking about Blue Cross Blue Shield. I'm sure you've all heard this, right? And what does Blue Cross versus Blue Shield cover? Well, they're actually two different things. So the Blue Cross component of Blue Cross Blue Shield is the entity that provides the benefits for hospital care. The Blue Shield component is the entity that provides the benefits for the surgical and medical services. Okay. So when we talk about Blue Cross Blue Shield as a company, okay, we're talking about the entity that provides the benefits for hospital, surgical, and medical services. Okay. It's just that each one of the two entities is responsible in their own right for taking care of the benefits for either hospital or surgical/medical. Okay. So when we think about the two different types of providers, private providers, okay, we're going to start the conversation by talking about HMOs, okay, or health maintenance organizations. So HMOs are what we call managed care. Okay, and managed care, okay, well, HMOs and PPOs are managed care. They provide different services, but they're both kind of classified at the macro level as managed care. And what they are is they're prepaid health plans, okay, for comprehensive healthcare to the members of the organization. Okay, and the two most common, right, managed care plans are the HMO and PPO, right? And within both the HMO and the PPO, okay, you have a primary care physician. Some cases you get to select whoever you want. In some cases, the primary care physician is given to you and you don't have choice. And as you can imagine, the more choice that you have, the more expensive the policy. Okay. We can love capitalism or we can hate capitalism, but there's one certain thing about capitalism. The more choice we have, the more expensive things are. So within the HMO, okay, the health maintenance organization, okay, the HMO contracts with selected care providers. Okay, there is a fixed prepaid monthly premium, and the focus of HMOs is on preventive care. The HMOs provide the basic and the supplemental services that you need for your health maintenance. Now, how does this differ from a PPO? Well, a PPO is what we call the preferred provider organization. Okay? And in a PPO, we have several different providers to choose from. Okay? We have choice. And with that choice comes the second bullet. It costs more than the HMO. There are specified services at predetermined fees that are offered to the PPO members. You obviously can choose, this is called out of network. You've probably heard this before. You can choose to go to a non-PPO provider for your healthcare. You still have choice. It's just that you're going to pay more if you go out of network. Okay, you're going to pay more. And this also includes what are called point of service plans, okay, where that's your most flexible, you have the most amount of choice, right, and go wherever you'd like to go. But again, HMO is going to be your cheapest option, but you have very little choice. You have no choice. You're told who to go to. You have the PPO, which is going to be more expensive than the HMO, okay, but you get a broader range of service providers. Okay? And then you have the option to do POS, point of service, okay, where you get to choose wherever you'd like to go. You go out of network, but you're going to pay even more to have that maximum flexibility. Okay. Other options that exist. You've got home healthcare agencies. These are agencies that are going to be providing assistance in the home, right, via an in-home aid. We also consider hospice care to be home healthcare agencies. You can have employer self-funded health plans, okay, where the company will collect premiums from you as the employee, and the company then pays the medical benefits, okay, as opposed to having a healthcare plan provided by Blue Cross Blue Shield. The company self-funds their healthcare plans. There's a risk to it, right? But nonetheless, the company can choose to use its own resources to cover the health needs of the employees. Okay, and we've got these different healthcare savings accounts, right, that you definitely are going to want to take advantage of. Okay, health savings account, health reimbursement accounts, flexible spending accounts, pre-tax dollars, okay, that you can contribute into, think of it as a savings account specifically for your healthcare needs. You can use it to pay for your copays. You can use it to pay for your deductibles. You can use it to pay for your prescriptions that you might need. You can use it to pay, again, toothpaste, all right, Tylenol, okay? Things that are used in your life that have some health related component to it. Okay, why toothpaste? Well, because it's preventative, right? If you brush your teeth, you don't have to go to the dentist nearly as often. It costs a lot more money to the insurance company every time you go to the dentist than it does to allow you to pay for your toothpaste out of your FSA, okay, or your health savings account, okay? So it makes sense. All right, and then we've got government healthcare programs. All right, so when we talk about government healthcare programs, we're talking about Medicare, okay? And there's many different parts of Medicare, right? But nonetheless, when you turn 65, you have access to Medicare, right? And it's a federal health insurance program, right, for those citizens that are 65 or older, but it also allows for provisions for certain types of disabilities, regardless of age, to receive benefits. Okay. So Part A, okay, so we're going to get into the different parts here. So Part A of Medicare is the hospital insurance, okay, the Blue Cross part of Medicare. Okay, so Part A is hospital insurance. Inpatient hospital care, inpatient skilled nursing facilities, home health care, hospice care, covered under Part A of Medicare. Part B, okay, is your medical insurance. This is the voluntary component to Medicare. You go see your doctor, okay, because you've got a sinus infection, right? That's voluntary. That gets covered out of Part B. Okay, so these are services that are not covered by Part A. Okay. We have what's called Medicare Part C, or the Medicare Advantage Plan, right? The Medicare Advantage Plan is what we call a gap policy. Anything that Part A doesn't cover and Part B doesn't cover, you can purchase supplemental coverage, and we call that Part C, Medicare Advantage Plan. And there are a lot of companies that sell these gap policies, okay? And then you have Part D, which is the Medicare component that deals specifically with prescription drug benefits, okay? And then we talked about Medigap, MedSup, which is essentially the Medicare Advantage Part C coverage, okay? So it's going to pay for what Medicare doesn't pay for, okay? And then depending upon your income, okay, you could have access to Medicaid, okay? Medicare is a federally administered program. Medicaid is the state administered program, but with federal guidelines. And it is typically available to lower income individuals and families. And when I say low income, I mean like really low income, like $15,000 a year, $25,000 a year, like, you know, right on the poverty line type low income. Okay, but again, the important thing here is that Medicare equals federal, Medicaid equals state. Okay. So finishing up our little conversation here, let's talk a little bit about disability income insurance. Okay. So does everybody need disability income insurance? No. Okay. And there are definitely going to be certain periods within your life cycle where disability income insurance may be more important than at other times. But disability income insurance is designed to protect your most valuable asset, right? And that asset is your ability to generate income for your life, okay? Whether that's life alone or whether that's life with a spouse or a partner, whether that's life with a family, meaning with children, doesn't matter. Okay, it's designed to protect your most valuable asset, and that's your ability to earn income. You're not spending the money that you're spending, okay, to be in class for 4, maybe 5 years to just see that opportunity flushed down the drain because of a disability. So the reality of disability is that disability is more likely than dying at pretty much any age. Okay, so it is a risk that is more likely to occur, okay, than death. And so when we talk about insurance products, you know, a term life policy, you know, would pay out in the event of your death, right? But if you were simply disabled, there are no income benefits associated with a term life insurance policy. So disability insurance becomes more important in the conversation. So most of your companies, all right, when you look at your benefits package, they're going to offer you some basic level of disability income insurance, one times your salary, okay? But they're also going to give you the opportunity to purchase more than the bare minimum. You'll pay for it, okay, but it's super, super cheap. So my recommendation is max it out, because it doesn't cost you very much, all right? But the benefits are significant if, for whatever reason, it needed to be, turned on. What does it provide? Well, it provides regular cash income, okay, that was lost as a result of the accident or illness. Okay, if you become disabled, all right, here's the facts. Your income is going to go down, maybe to zero, right? But your medical expenses are going the opposite direction. They're going up, right? Because you're going to need help in the house. You're going to have to go see your doctor more frequently for checkup visits. Okay, so your income goes down, your expenses go up. So the disability income insurance is designed to help with this. So the definition of disability, and I wish that there was a very clear definition of disability. However, there's not. Some policies define it simply as the inability to do your regular work. Okay, and that is very vague, right? And it is, in some cases, intentionally vague. Good disability plans, okay, will clearly specify, right, that it will pay or supplement your income when you are unable to work at your regular job. Okay, there's a difference. And again, we've talked about this many times. Words matter. Okay. Simply unable to do your regular work is different than unable to work at your regular job. Okay, there's a huge difference there. And then poor plans, okay, will only pay when you're unable to work at any job. Okay, again, words really matter here. Okay, if you were, an investment banker pulling down $350,000 a year, and you had a poor disability plan and you wound up being disabled, right? The poor disability plan wouldn't kick in, because it's highly likely that you could probably go get a job at McDonald's, okay, or at Target, okay, or being a greeter at Walmart, right? So poor disability plans are going to have this clause that says when you are unable to work at any job. Okay, so words matter. Read it carefully. Okay, just like in the basic healthcare insurance plans, we've got trade-offs with disability insurance. Okay. A waiting, what we call elimination period, meaning there's a period of time after you file for the benefits from this insurance plan, a period of time where you have to wait before the benefits start getting paid out. Okay. Sometimes it can be upwards of 90 days, 90 to 120 days for this waiting period. Okay. So they're not going to start paying you right away if your disability is simply going to be short-lived. Okay. So you can file, but you're not going to get the benefits until this waiting period terminates. Duration of benefits. How long will you receive these disability income benefits? Okay, and it's going to vary based upon the policy. What's the amount of the benefits? Does it cover your entire salary? Does it cover your entire salary plus your bonus, meaning your total income for your job? Okay. Is there a maximum amount of benefits that the policy will cover? Accident and sickness coverage. Okay. Is there a provision within the policy for accidents that happen or for illnesses? And is it guaranteed renewable? So as long as you continue paying the premiums, it cannot be canceled or terminated. Okay, very important to understand that. Okay. And so when we think about the sources of disability income, where do we go about getting these policies? Well, first and foremost, from your employer, right? And their group plans. And it could be short-term plans, long-term plans, right? But it's being provided to you by your employer, right? And in this case, most insurers are going to limit the benefits from all sources. Okay, very important, words matter. From all sources to no more than 70 to 80% of your take-home pay. Okay, so your after-tax pay. Okay. Social Security has a disability component to it. Okay, and with the SSDI, Social Security Disability Insurance, okay, it covers total disability that lasts more than 12 months. And again, words matter. You must be unable to do any work, period, any work. Right? And then workers' compensation is another form of disability income, okay, which becomes applicable if the accident or illness occurs at your place of work, okay, or your accident or illness resulted from the type of employment that you had. Okay, so I'm sure you still hear about the issues with Bethlehem Steel, okay, and how Peter Angelos made all of his money suing the pants off of Beth Steel for asbestos related issues. Okay, so workers that suffered asbestos related injuries, okay, they incurred those injuries as a result of the type of employment that they had, in addition to a lot of other things, right? But nonetheless, they were entitled to workers' compensation as a result of the fact that the illness resulted from the type of employment that they were in. Okay. So that's our conversation around healthcare plans and disability income. Right. I hope you found it informative. If you've got any questions, please, let me know. But I also hope that what you took away from this is also a few of the reasons why, when compared to other healthcare systems around the globe, that the healthcare system in the United States, it is more expensive. Okay, and it's more expensive because we have all these options, okay, that other countries don't offer to their citizens, to their workers. Okay, so as we've said before, the more options we have, the more expensive the overall package is going to be, right? And I think you've seen that in our discussion today. If you have any questions, please reach out and I'll be happy to get back with you as soon as I can. All right, have a good one.